Okay, okay. Can you see the PPT? Okay. So basic, it's a small sweet discussion on ultrasonic energy devices. So this has been a revolution in the field of laparoscopy because the earlier energy devices had a lot of limitations. As I've already taken in the last class, some energy devices have a lot of thermal spread. Some don't have enough control. Some are not capable of being used in certain critical areas. So this is one place or one energy device which has got versatile uses in multiple areas. So primarily any energy device, just like our ultrasonic device, I'm just using ultrasonic device because ultrasonic device is just the what do you say, it's like calling a bipolar energy. It has got different companies, but the one I use most commonly, this is not for promotion, this is not for any kind of sales or promotion, but what I use is harmonic by Ethicot. So that's why I invited their technical people also, those people who handle pan Kerala, because if there is something deeply technical which I may not be able to answer, you're free to ask them. We have Suhail with us, we have Abhilash with us. Abhilash handles pan Kerala, Suhail handles certain regions, so I've just invited them also, so that you don't miss out on any of these points. Primarily, like any other energy source, even an ultrasonic energy source is used for coagulation and cutting primarily when it comes to gynecology. So even like any other ESU is just electrosurgical unit. This also has three parts, but this has the three distinct parts compared to when you compare with other energy sources. One is the generator, second is the handpiece, and third is a probe. Now, the question is, how does an ultrasonic device differ from a normal bipolar energy? See, finally, for any vessel sealing, you require thermal energy. Be it any sort of vessel sealing, be it bipolar, monopolar, ultrasonic, everything you require thermal energy, because the simple principle is heat evaporates the water from the the vessels, which causes the proteins to denature, and then it starts sticking to each other, which is called sealing. So in this specific case, what happens is, why is it called ultrasonic energy? You can see the generator here, which is written 3.5. So this is the basic generator. So what happens in this is electrical energy. We plug in this generator. Electrical energy is created inside this generator. That's why it's called a generator. It generates electrical energy. The same thing happens for bipolar and monopolar also. We have a generator there. But the key lies here in this equipment. This is called the handpiece. Why is it called the handpiece, and why this peculiar piece, peculiar shape? See, if you see the shape here, this bottle kind of shape here, this is the device which plays the key. This converts the electrical energy which comes from the generator into ultrasonic energy of this device. So this is where the conversion happens. And this conversion happens because there are quartz crystals inside this handpiece. So electrical energy gets converted into sound energy. Ultrasonic energy is basically sound energy. We call it ultrasonic because this is converted into a frequency of 55,000 hertz 55,000 hertz. That means 55,000 vibrations happen in 1 single second. So this is how conversion happens from electrical energy with the use of handpiece into the probe, which is what we use for coagulation and cutting. And there is a vibration of the tip of the instrument to the tune of 55,000 hertz, which is equivalent to 55,000 vibrations per second. So this is how the entire energy pattern flows. I'm sure a lot of people are not aware of this. How, why it is called ultrasonic, how is it different? So that's why because I very commonly use this device, and I'm very friendly with this, and it has increased my surgical skills and depth a lot. So just repeating, generator has the electrical energy which is from the KSCB or UPS it comes. In between, this handpiece is there which has got quartz crystals which converts this electrical energy to sound energy. Sound energy is basically vibration. We call it ultrasonic because it's in the ultrasonic range, and this gets transmitted to the probe, which is 55,000 hertz or 55,000 cycles per minute. So this is how it is transmitted. Now, next thing what happens is, what you have to know is, if you can see, just a minute, I'm just minimizing this. Okay. If you can see these two, can you see my cursor? Is everybody able to see my cursor? What I'm pointing at? Okay, basically
Yes, sir, it's visible. Visible.
this harmonic probe has the handpiece connected at the back. So this is where the conversion of electrical energy to the sound energy happens. This sound energy or the vibration is directly transmitted to this instrument. And here if you see, there are two blades for this instrument. In this, the one with the white coating or the Teflon coating is the passive blade, and that is the only blade which moves. It's called, that's why I've written mobile passive blade. This blade has no action in coagulation, no action in cutting. It is mobile. It only acts as a support. And the second blade you see, this blade is the active blade. This is the blade which is going to vibrate at 55,000 hertz or 55,000 cycles per second. And this passive blade is only used for support. So for example, if you want to coagulate a vessel or be it any tissue, you have to hold the tissue against something so that the coagulation can happen. So in principle, what happens is the tissue, consider a vessel. The vessel comes in between these two blades, and this acts as a support, and this blade goes in and out in a fashion that it is not visible. It is 55,000 hertz, mind you, 55,000 cycles per second. So when that happens against this passive blade, when the tissue is kept here and this rubbing action happens, basically it is creating friction, which then gets converted into heat, and that heat is going to coagulate or seal the tissue or vessel, whatever is in between. So the principle is, the more you pressurize or more pressure you apply, what is going to happen is it is going to crush the tissue and cut it prematurely. And lesser the pressure you apply or lesser pressure if you apply, no amount of sealing is going to happen, because there needs to be moderate amount friction which has to be generated for the sealing to happen. There are two ways of activating these instruments. I have put hand control here. People who are not able to use the foot pedal can use the hand control. Who are very comfortable with foot pedal, because I completely work with the foot pedal, can use the foot pedal. So basically you have got two options. This option is not available for a bipolar or a monopolar also. Only this instrument uniquely has this. Even Legashore has it, which is a different energy source. But this has, if people are not comfortable using the foot pedal, they can use the hand control here. So I hope this is clear so far. Basically, this is where the entire key lies. The passive blade having the Teflon coating, the active blade which is going to vibrate. The tissue is kept in between these two blades. This active blade rubs on the tissue with support against this passive blade, and then heat is generated and the tissue gets coagulated. Now the key is, if you see this passive blade, with each progressing case, this passive blade Teflon is going to get damaged slowly by slowly. Depends on how well you use the instrument, how capable you are, how much expertise you have. The more pressure, or if you start crushing the tissue or start activating this instrument even without any tissue in between, what happens is this blade is going to directly damage this Teflon, and there is going to be a groove which is formed. So the life of this instrument lasts as long as this Teflon coating is intact or at least semi intact. That is the entire key of this instrument. So a lot of people say this is costly, we are not able to use much and all. The only problem is that you're not keeping enough tissue between the blades, or even if you are keeping tissue, you are crushing it, or you are continuing to activate the instrument even after the tissue is cut or coagulated. So the number of cases you can preserve this Teflon for, that long this instrument will last. You'll be amazed to know, even these Ethicon people are amazed, because some of my this instrument probes last for 20 to 25 cases. That is just because, not about any great thing, it's just because how much you preserve this Teflon coating. That is the key about this instrument. Okay, now next most common question which is asked is, what is the setting? Is 3 coagulation and is 5 cutting, or is that how it is designed? Okay, so to be very frank, the instrument doesn't know what is cutting and coagulation, and neither has the company designed anything for coagulation or cutting. So this 3 and the 5 setting just means minimum and maximum setting. So even in your hand control and your foot pedal, you have got two separate switches for this. So this minimum can go up to 1 also, and the maximum will remain 5. It cannot be. So any settings you want to use, you can use based on how you want to design it. The difference between the minimum settings or the minimum setting and the maximum setting is just going to be the extent to which the blade is going to rub. For example, if it's a minimum setting, the blade is going to project longer. The frequency is going to be same, but the blade is going to have a more increased rubbing action, as in basically it is going to rub linearly. It will move in a slightly longer fashion, so that the amount of friction generated and the amount of thermal heat generated is going to be more. So that is why people have started equating the minimal this thing with the coagulation part. And when it comes to the maximum setting, what happens is the frequency or the vibration is going to be same, but the length of vibration is going to be shorter. In summary, what basically happens is that the amount of pressure you apply and amount of time you're going to spend on each tissue that decides whether the tissue is going to get coagulated or cut. You can cut the tissue even at a minimum setting of 1, and you can just purely coagulate the tissue even at a setting of 5, because it totally depends on how much pressure you are going to apply and how long you're going to do the process without injuring the tissue. Have you got the gist of this part? Because this is going to be the most tricky part. Lot of people get confused here. Everybody says 3 is coagulation and 5 is cutting. There is nothing like that. There is nowhere written in the machine or the manual or anywhere, or even the company people won't say that there is anything called coagulation or cutting. It all depends on how we are going to use the the probe, and how we are going to use the settings.
Dr. Akshay, can you just repeat that a little bit slow again, one more time?
Okay, what did you understand? Because I'll take it from there.
I understood that the length, how much it comes out, and the pressure that is applied. The pressure is important, and it decides how much heat is generated, and
Yeah.
it decides which cuts and which coagulates.
Yeah, same thing. So basically, I'm just trying to say that the settings are immaterial.
Oh, okay.
Don't say 3. So people say 3 is for coagulation. I'll coagulate the vessel using 3, then I'll cut the vessel using 5. So
Hmm.
in essence, what happens is that when you put it on 3, there is definitely going to be more amount of friction generated because of the length of the blade which acts, or the active blade is going to be slightly more. This is just logical. Like,
Okay.
just if you rub
Okay.
for a certain distance and if you rub for a longer distance, the one you rub for a longer distance is going to generate more friction and more heat.
Okay.
Even at 3, in spite of this longer friction and all those things, if you apply excessive pressure, it'll cut immediately.
Mm.
And even at
So
5,
3 is how much the needle comes out, and what is 5?
5 is basically the same amount of frequency, but the length of that vibration is going to be lesser.
Okay.
So basically what happens is that it all depends on how much pressure you are going to apply and how much time you're going to spend at each tissue. You can basically, you can cut at 3, you can coagulate at 5 also. You can coagulate at 3, you can cut at 5 also.
Okay.
Basically, don't bother about 3 and 5. That is what I'm trying to say.
Yeah, I got that.
Okay. So whenever you're trying to coagulate, especially a vessel or a tissue, always try to hold the probe, the blades perpendicular to the tissue, especially the vessel. Because if you hold at an angle, it is going to cut through. So always hold it perpendicular to the tissue, and make sure that if you understand the concept of the active blade and the passive blade, if you're activating the instrument even with the passive blade against a bowel, nothing is going to happen. Because the passive blade, that is this blade with the Teflon coating, is designed in such a way that there is no energy transmission here. There is no vibration, there is no energy transmission here. So even if you touch it against a bowel and activate the instrument, nothing is going to happen, because only the active blade is going to get activated. This is one beautiful aspect of this instrument, which is not seen in most of it. At least a normal bipolar, both blades are active. A monopolar, you can never think of doing like that. But in this safeguard mechanism is given so that the passive blade can be rested against vital structures like a bowel, even a ureter, even a bladder, and still be activated, because only your active blade is going to get activated and do its role. And because of this safeguard mechanism, always try to keep the active blade under your direct vision and keep the passive blade away, just for safeguarding against the vital tissues. And as I said earlier, always modulate the pressure, because it all depends on how much pressure you apply. If it is a tissue which is avascular and you want to cut soon, as like few of you have at least observed in the surgeries I do, if it's an adhesiolysis, we just directly cut through without anything. If it is a peritoneum, we directly cut through. If it's an avascular structure like vault, we directly cut through. But if you feel it's a vascular structure, then apply moderate pressure and see that enough amount of cooking or the sealing of the tissue happens before you apply pressure to cut it. So you have to modulate the pressure. You have to be patient with your time. Only as a combination of these two will you be able to master the harmonic scalper or the ultrasonic energy to use for your surgeries. And again, everybody has this complaint that economics, because it's a costly machine, costly thing. See, it all depends on how we are planning to use it and how you use it. Because if you use it properly, you can get one harmonic probe even up for 22, 25 cases. Company may not say so much, company may say 4 to 5, so you may calculate total cost divided by 5. But if you use it properly over a period of time, I can guarantee you can easily go up to 15 to 20 cases. In some exceptional cases, you can go to 20 to 25 also. So this is in short about the ultrasonic energy. I'm just calling harmonic scalpel because that's what I use most commonly. So have you understood the gist of it? Do you want to ask any questions? And even our company people are here. If there is something deeply technical, they can also address it.
Dr. Akshay, what exactly do you mean by modulating the pressure? You mean the pressure you apply on the hand instrument, is it?
Yeah. So for example, I'm just showing this is a vessel. So you can hold these are the two blades of the harmonic scalpel. You can hold it this way, or you can completely crush it this way and activate the machine. Have you understood the difference between modulating the pressure? You can either just touch
Yes.
the vessel like this and just keep on heating it like this. Or you can completely approximate the blades of the instrument and completely crush it like this. In this scenario, what will happen is the vessel will get immediately cut without any sealing. But if you keep it just touching like this and keep on activating the instrument, what will happen is there will be a lot of friction, lot of heat will be generated. So what I ideally do is always say for a vessel like this, and fortunately this is red also. If you're going to cut it here, you spend some time here, coagulate it like this, then spend some time here which is distal, that is to prevent the backflow. Then you spend some time here proximally, which is to cut the supply to the area. And after clipping at these 3 points, if you had seen, I would be doing this action mostly. Those who have observed my surgeries, if you go back and see in YouTube again, I'll be doing this action continuously. By doing this, what happens is this much length of the vessel is going to get coagulated, or this is clipping action, and nothing will get cut. And finally, I decide this is coagulated enough, then I'll fix a point, which is the midpoint. Then I'll completely apply pressure here, crushing it so that it will get cut and come into two pieces. Many surgeons, what they do is whenever they want to do anything, they completely go and crush the tissue like this without modulating. They just directly go and crush it. Is that clear? Have you understood the modulating the pressure part? And the same thing applies on the hand. The probe which has the action mechanism. It directly translates the amount of pressure you put on the palm like this. It gets translated to the pressure which you put on the tissue.
Hello, Akshay.
Yeah.
Ramesh here. The 3 and the 5. Why 3 and 5? Like most of the places I've seen that they keep it at 3 and 5. So why 3 and 5? Because according to what you said, it doesn't matter if you do it with the pressure modulation. If you do it correctly, it doesn't matter. So why 3 and 5?
Another secret I can reveal is that I never use the minimum pedal. I only operate at the maximum pedal. So I only keep it at 5 and modulate whatever pressure I want, and however I want, I modulate it and I do it. I usually don't use the 3 this thing. See, it is just for safety's sake, because it's not necessary that 3 and 5. Some people keep at 1 and 5 also, 2 and 5 also. So if you have certain vascular structures which you want to spend a lot of time upon, and you want to completely coagulate it before going to cutting, then these lower settings help. It is basically when you travel from 1 to 5, the length of the blade which happens in the friction, because the length, that is, I'm saying this length motion, linear projection which is going to happen is going to decrease from 1 to 5. It is going to be maximum at 1, it is going to be minimum at 5. So when there is more projection, the friction generated is going to be more. There is going to be more safety at lower settings from a coagulation point of view. And as it travels more towards a 5 setting, there is more safe, more ease in cutting point of view compared to coagulation. But again, repeating, at these same points, you can even cut at 1, you can coagulate at 5 also. Abhilash, do you want to add anything on this? Why 1 and 5? Why have you kept 3 and 5? What is the company perspective on this?
Sir, actually, the 3 and 5 is the standard term at which the harmonic comes. So, as you pointed out, it depends upon the surgeon and his preference. They can adjust it. So, basically, 3 and 5 is the standard one, and it is the one which is globally accepted for using in the most of the surgeries.
Okay. Abhilash is the Kerala head for Ethicon. So I've seen surgeons using 1 and 5 also. Some people use 2 and 5 also. So some people spend lot of time on the minimal settings in a vascular structure until they're convinced that it is not coagulated. After that, they shift to the maximum settings. So that's a safer way to do, but it all depends on you how you want to modulate it. Just trying to give a summary and repeat. Basically, don't get fixed with these numbers of 3 or 5 or whatever. Develop your own technique. You can do everything at 5 also, you can do everything at 3 also. But 3, if you try to do everything, it may take some time. It will take more time compared to 5.
Okay, please, Anand.
Any more doubts regarding the ultrasonic energy? Now you would have understood why it is different from the other energy sources. You have got a safe passive blade. You can even touch on a bowel or a ureter and keep on activating it. Nothing will happen because only the active blade is going to move. So this is ideal for working in the retroperitoneum, ideal for working in the recto-vaginal space, even bladder base. All these areas it's very safe to work with. Dr. Millen, did you get that point or are you still confused about it?
No, I got it. I understood that we can get the best at 1 and 5, but please safely do it 3 and 5. I think that's what I understood.
No,
One is
it's not what you get best at one. See, if you are looking from a perspective of generating maximum amount of heat and being very safe, then one is best. So safety factor reduces from 1 to 5. Coagulability factor reduces from 1 to 5. But with a catch, at any point, it also depends upon the amount of pressure you apply also. In short, what I'm saying is, even though you say 1 is safe, you can cut at 1 also.
yeah.
It's like you're driving a car versus wearing a seatbelt and not wearing a seatbelt. Wearing a seatbelt is always safer. But you can have an accident after wearing a seatbelt and get injured also. But when
Yeah.
you see it from a statistical point of view, wearing a seatbelt and driving, the point of accident is lesser and the injury possibility is also lesser. But you still can have it. The same way, 1 and 5, from a perspective for coagulation and safety, 1 is best. And it keeps on reducing till 5. It more for cutting and more for what is a lesser coagulability. But it all depends finally on the pressure you apply also. At 1, if you keep on applying maximum pressure and crushing the tissue, it will get cut easily. There is not going to be any coagulability. And even at 5, if you don't crush at all and if you keep on activating it for a very long time, the vessel is going to be beautifully sealed also without cutting.
So one is the long need, the need coming out length, right?
Yeah,
Which is the maximum energy.
maximum length.
Maximum.
It comes, frequency is going to be same. The friction generated is going to be maximum. So maximum thermal
Maximum,
energy.
yeah. Okay. Yeah, I got it.
Akshay, one more thing.
Yeah.
If we think about it logically, like when we are doing a hysterectomy, I'm not thinking about like maybe yes, the vascularity more than just using the instrument. When you consider a round ligament, which is not very vascular, when you do the minimum setting, that is when you said you don't use the minimum, right?
Yeah.
So when we're doing the minimum, pressing the minimum button, it takes a longer time to coagulate and cut. If you're using the same amount of pressure, like yes,
Correct.
it takes a longer time to coagulate and cut.
Correct.
So if we are using minimum and coagulating and cutting, it just takes longer. And that would be you done at the 3. If you're keeping it at 3 and 5, that would be done at 3.
Yeah.
The coagulation and cutting happens at 3.
Yeah.
While if you are using the maximum button,
Yeah.
the coagulation and cutting is happening at 5.
Yeah.
But it is faster. The
Yeah.
coagulation or the thermal energy is less, and it gets cut faster.
Absolutely.
If the pressure is used, of course, I understood that the pressure used can be different. The cutting can be different with different pressures, but with the same pressure used, when we're using the minimum button, it works at 3, and when we're using the maximum button, it works at 5.
Yeah.
Right.
Correct.
Okay.
Again, there my key point would be that if it's an avascular structure, never use minimum. Directly go for maximum and cut it because there's nothing to coagulate. Round ligament,
Yes.
peritoneum, fallopian tube, UV fold of peritoneum, vault. All these places don't use minimum itself. Directly cut it because there is no vascularity you're trying to preserve. IP ligament, corneal vessels, uterine artery, and some parts of the vault. This is areas where you need to be careful about coagulation.
Yes, Akshay. Thank you.
So any more questions on ultrasonic energy, or is it completely clear? So I think we have more or less covered it. I would like to thank Abhilash, the Kerala head of Ethicon, and Suhail, who is a regional head who has joined us for this presentation. And in case you have any doubts regarding ultrasonic energy, feel free to just message me. And even if you want to get connected to these people, just let me know. I'll share the numbers because this is something which has transformed my practice a lot because they have seen my growth, how it has happened. And trust me, even though company says only 4-5 uses are possible for one instrument, I have got up to 20-25 also. So it all matters on how you use it, how you modulate it. That is the key to using it in a best possible manner. So thank you all for joining. We'll wind up for today. We'll come up with next topic on next Wednesday. Thank you.